Hello everybody, this is Dr. Terry Chen. I'm a chiropractor with Spinecare Chiropractic and we are based in Penang, Malaysia. Previously, I made two videos. One video was titled What is Slip Disc, and the second one was What caused slip disc. So if you have no idea what is slip disc, I suggest you might want to look into those two videos on our YouTube channel or our Facebook page first before proceeding to watch this video. For today, I'm going to explain how do we treat slip disc. So on this picture here on the left, this is a picture of your bones and your spine. So imagine this white color thing here, this is your bone, okay? And at the bottom, this is another bone. So in between the two bones, this gray material here is your disc. If you look at this disc from a cross-section top view, then the disc is round. It looks like a donut, and it has an inner structure here which is dark gray. It's called the nucleus and it's a liquid, and then it has an outer ring here called the annulus. So this outer ring is more solid. It's like a cartilage material, okay? At the back is your spinal cord, and the left and right this is your nerves, okay? So when you have slip disc, basically what happens is this outer ring, the annulus, it gets damaged and it gets torn, and then the fluid in the center, it leaks to the back. So for example, if it leaks to the right, then it will affect the nerve on the right, and you might get pain or any symptoms or numbness on the right side of your lower back, for example. If it hits the left, then you get the left. If it hits the center, then unfortunately you get pain or symptoms on the left side and also the right side and also in the center, okay? So when it comes to slip disc, right, notice, for example, in this scenario, the outer ring is still quite intact. So when the outer ring is still quite intact, chiropractic can help to treat this condition and ensure a good recovery. However, if the slip disc is very bad, what you can get is the outer ring is completely torn, and then the nucleus, the inner layer, it flows out to the spinal canal at the back. So this is a very serious case of slip disc already, and you may require surgery to fix this problem. However, if the outer ring is still contained, then chiropractic can still do the job in most cases. So the first objective of treating the slip disc is to take pressure off the nerves, because when it's pushing on your nerve, you get a lot of swelling and inflammation, and it's causing a lot of pain. So what we need to do is to take pressure off the nerve. When you take pressure off the nerve, the pain will subside and get less and less. However, this is only short-term pain relief because the disc is not fully healed, as you can see. If you want long-term pain relief and you want the disc to be fixed and recover as much as possible, then we need to continue on. So the second objective is to continue to treat the disc so that it can make as close to a full recovery as much as possible. So how do we actually go about and treat a slip disc? So this is how this looks like. So as I mentioned just before, the nucleus, the inner material is like a liquid in the center, and then outside is like a ligament or like a cartilage material. It's more solid, okay? Now the disc needs like a sponge-like pumping action to absorb nutrition. So it needs to absorb clean fluids, and so that it gets proper nutrition, and also it needs to pump out all the toxic waste and toxic fluids. If the disc can have this pumping action whereby it can continually pump in the clean fluids and new nutrition to regenerate and rehydrate and also let the disc heal and function properly, then it's healthy. Then it also needs to expel and basically get rid of all the toxic waste. So a healthy disc allows transfer of fluids. Now for this function to happen, for the disc to keep pumping fluids in and out, remember this function has to happen continuously for the disc to be healthy. For that to happen, the bones at the top and at the bottom of the spine, of the disc, also needs to move. So if these two bones are not moving properly, it will have a negative effect on the disc. So I will tell you in more detail what I mean. So for example, in this case, the spine on the left, you see it can bend forward, and all the spine and all the bones are moving nicely. So it can open up when you bend forward, and then it closes when it bends back. Now, look at this example here. Because this bones is stuck, it's not really opening or closing. So when you bend forward, nothing really happens. So in this case, the disc is not really pumping anymore. It doesn't have the pumping action, so thereby there is no clean fluid and nutrition to come into the disc to help the disc regenerate, and the toxic waste is stuck here. It cannot expel the toxic waste. And what happened is, because this disc is not functioning properly, the top and the bottom is actually working harder to compensate for this disc. So what you will have eventually is all the three discs here involved will be damaged. So how do we treat this slip disc problem? Basically, there are three ways to treat the slip disc. One of the ways is to use a gentle method where we use an instrument that is connected to a machine and a computer, and we can calibrate the force and the frequency and also the direction of treatment. And basically we place the instrument on the spine, and it has a vibration effect on the bones. So when the bones vibrate and move, it will induce a pumping action on the disc, as I mentioned in the graphic previously. So when the disc starts to pump, it can absorb fluids and expel waste, toxic waste, and the disc starts to recover and start to heal. So this is one of the methods that we use to treat the slip disc. This method is very safe, very gentle, very comfortable and effective. So this is the least invasive way. This is the most of the time we use, this is the first method we use to treat the slip disc. Another way that we can use is basically traditional spinal manipulation. So what that means is we identify the area and we place our hands carefully on your spine, and we put a force into a spine to manipulate the spine. And what that does, it creates a motion in the bones. So when you have motion in the bones, you can also have motion in the disc, and this can help in the recovery process to not only take pressure off the nerve, but also decrease the swelling and so forth, and get your body on the road to recovery. So this is the second way. A skilled chiropractor should be able to manipulate your spine in a safe way to ensure recovery and to prevent injury, because manipulation is a more invasive procedure. So in the wrong hands, it can potentially make the problem worse. So we don't want that to happen. So make sure you find someone that is good enough and skillful enough, and that you can trust to perform this spinal manipulation. The third option that is available for treatment is what we call spinal decompression. Basically what happens is we will ask the patient to lie either face down or face up on a specialized bed, and we will use some cables to tie around their body, and it will attach to this machine at the back over here, and we can calibrate and adjust the force of pulling. Basically what it does is it tries to mimic the pumping action of the disc. So you can see there's positive and negative pressure. This machine is trying to mimic that natural pumping action of the disc to help regeneration and to help you from your recovery. At Spinecare, we have a specialized bed where we can tilt the angle up and down, left and right, to further target the involved disc that is injured, and we can also add some vibration feature to help stimulate the recovery and speed up the recovery. So this is the third option that we use to treat the disc. Obviously, in addition to treatment in the clinic. What we also need to advise you is what exercise you can do and what exercise you cannot do at home. Any other things that you can do at home to help speed up recovery, what supplements to take, how to sleep, how to sit, how to look after your posture, and so on and so forth. So all of this plays a part in your recovery of your slip disc injury. Now obviously, the earlier you seek treatment, the better the outcomes of the treatment. If the slip disc is too serious, then chiropractic care may not be able to help you anymore, and we may be sending you for surgery or for a second opinion. So the earlier you seek treatment, the better the outcome and the better the recovery. So in summary, the first objective of chiropractic treatment is to basically take pressure off the nerve so that it relieves the pressure and also give you the pain relief. But this is short-term recovery. The second objective of treatment is to make sure that this recovers as much as possible, as close as possible to the full function. So those are the two main objectives when we treat slip disc as a chiropractor. So I hope you have learned something today, and I thank you for watching. If you have any questions related to this condition or any other questions, please feel free to send us a message on Facebook or email us or give us a call. If you would like to be updated regularly on when we release our new videos, please like our Facebook page and also subscribe to our YouTube channel. Until I talk to you next time, it's goodbye for now.